name's Mariah. I'm going to be your student nurse today. How are you doing?
I'm doing good.
All right. So before we get started, I do just have to verify your name and your date of birth.
My name's John Doe. Birthday is January 3rd, 1980.
All right. And what's your medical record number?
1, 2, 3, 4, 5, 6.
Okay, great. That all matches your wristband there. Do you have any allergies and medication?
No.
Food?
No.
Latex?
No.
Tape?
No.
Environmental?
No.
All right, very good. That also matches your wristband. Do you have any, I have your vital signs here. So I'll read those for you. So your blood pressure's at 120/78. Your heart rate's at 72. Your respiratory rate is at 18. Your oxygen saturation's at 99%. And your temperature is at 98.7. And those are all good and within normal limits. Now, do you have any pain today?
Yes.
And when did it start?
It started yesterday.
And where is it at?
My knee.
Okay. What does it feel like?
It's just like a sharp pain.
Okay, and how long does the pain last?
It lasts for about 15 minutes after I put pressure on it.
Okay. Is there anything that makes it feel worse?
Yeah, when I run and walk on it.
Okay, is there anything that makes it better?
When I'm sitting down relaxing on it.
And have you used anything to treat it?
Just over-the-counter pain medications.
Okay, and on a scale of a 0 to 10, how bad is it?
I'd say it's about a 7 or 8.
Okay. All right, so now I do just have to assess your level of consciousness. You told me your name and your date of birth. Can you tell me where you're at right now?
I'm at the doctor's office.
Okay, and what's today's date?
Today, I believe, is the 18th.
Yep. And can you tell me why you're here?
I'm here to get my knee checked out.
Okay, very good. So patient is alert and oriented to person, place, and time. And I don't see any signs of distress. And I do see you have a nasal cannula here. So I'm just going to go ahead and check for any skin breakdown, rashes, or lesions. And I'm going to follow this tubing, make sure there is no kinks. And I'm going to check the flow rate with the doctor's orders. And that matches there. Now I'm going to check your IV. Do you feel any tenderness?
No tenderness.
All right, I don't see any redness, skin breakdown, lesions. I'm gonna follow this tubing as well. Check for any kinks and check the flow rate. And that flow rate is also what the doctor ordered there. All right, I'm gonna go ahead and check your hair. All right, your hair has even distribution. I don't see any skin breakdown, rashes, or lesions on your scalp. And your skin feels warm. The color is appropriate for ethnicity. And check your skin turgor. Skin turgor has good elasticity. And I don't feel any edema. And can I check your nails? All right, and capillary refill is less than 3 seconds. And less than 3 seconds bilaterally on your toes as well. I'm gonna go ahead and check your ears. All right, I don't see any lesions or drainage on your ear. And I don't see any lesions, rashes, or drainage in this ear either. Now I'm gonna check your eyes. So if you could just follow my pen light. All right, very good. Now if you could put your hand up in the middle of your face, and I'm gonna shine the light in your eye. Check your pupils. And one more time. Okay, very good. So pupils are equal, round, and reactive to light and accommodation. And your sclera is white, and your conjunctiva is pink and moist. All right, I'm gonna check your nose. I don't see any drainage or skin breakdown in the nose. Can you open your mouth for me? All right, so your oral mucosa is pink and moist. I don't see any redness or sores in your mouth. All right, and can you smile for me? Okay, and your face is symmetrical. All right, so now I'm gonna check your respiratory system. Do you have any trouble breathing?
No.
Okay, I don't see any labored breathing or use of accessory muscles. So I'm gonna go ahead and listen to your lung sounds in the back, so if you could just turn for me. Okay, and when I put my stethoscope on your back, if you could just breathe in and out. All right. So all of your lung sound clear. And your chest wall expansion is equal bilaterally. Okay, so you can go ahead and turn around. And at this point, I would teach you how to use an incentive spirometer, and you would demonstrate how to use it for me. So now we're gonna move on to the cardiac system. So I'm gonna go ahead and feel your carotid pulse. Very good, I don't feel any thrills. And I don't feel any thrills on that side. I'm gonna go ahead and feel your radial pulses. You can just open your hands for me. Alright, so your radial pulses are equal bilaterally, and your pedal pulses. Alright, and your pedal pulses are equal bilaterally, and they're all +2. So now I'm gonna go ahead and listen to your carotid pulse. All right, and don't hear any bruits. So now I'm going to listen to your heart sounds. I'm going to start, first I'm going to palpate your PMI. Okay, I don't feel any lifts or heaves there. So I'm going to listen to your heart sounds. I'm going to start with the aortic on the right sternum border in the second intercostal space. Then I'm going to move over to the second intercostal space on the left sternum border for your pulmonic, and down to Erb's point, the third intercostal space on the left sternum border, down to tricuspid on the fourth intercostal space on the left sternum border, and to your mitral on the fifth intercostal space, mid-clavicular line. And then I will do all of those with the bell and diaphragm. All right, so there's regular rate and rhythm throughout, and I do not hear any extra sounds. All right, so now we're going to move on to your GI system. Now, have you had any nausea, diarrhea, or vomiting?
No.
Okay, and when was your last bowel movement?
It was a couple hours ago.
And was that normal or abnormal for you?
It was normal.
Okay, do you have any dietary restrictions?
No.
Okay, so I'm going to have you go ahead and lay down on your back. All right. So upon inspection of the abdomen, it appears flat and symmetrical. I don't see any pulsations or masses. So now I'm going to go ahead and listen to all 4 quadrants. Alright, so all of the sounds were normal active. If I did not hear any sounds, I would listen for 5 minutes in each quadrant. I'm going to go ahead and listen to the aorta. Alright, and I do not hear any bruits. So now I'm going to go ahead and palpate each quadrant. Alright, now I'm going to deeply palpate each quadrant. All right. So I did not feel any tenderness. The abdomen was soft and there was no guarding or masses. Okay, so you can go ahead and sit up for me. And have you had to urinate more than usual lately?
No.
Okay, and when is the last time you urinated?
A couple hours ago.
Okay, and was that normal or abnormal for you?
It's normal.
Okay. Right, so now I'm going to assess your extremities. Do you have any tingling or numbness in any of your extremities?
No.
Okay. Can you go ahead and grip my hands for me? Okay, so strength is equal bilaterally. Now I'm going to have you turn this way. I'm going to check your dorsiflexion and extension. So can you just point your toes up and resist me? And point your toes down and resist me. All right. So the strength is equal bilaterally. Both dorsiflexion and dorsiflexion are present. And the muscle strength is a 5 with full range of motion against resistance and gravity. All right, so you can turn back around for me. So would you like your bed to be lowered?
No, I'm fine.
Okay. And I'm gonna put up your side rails here.